Well, the Western Cape is the third province to record a coronavirus case in South Africa. Western Cape Health MEC Dr.Nomafrench Mbombo joins us now for more information. Doctor, thanks a lot for joining us this evening. I can imagine that the Western Cape now is on high alert following the return of that individual from Europe. He returned on the 9th of March. Are we able to contain this virus in the Western Cape?
Thank you, Faith. We've been on the alert even before we got the case that is being tested positive, because up to now we've tested about 87 people which have tested negative now, except this one. So immediately when the coronavirus was already spreading, we have to be prepared, we have to be ready, because we'll never know, specifically because we are the hub where there was a lot of international visits, the visitors, same as with the Gauteng. So we have been ready. Tigerberg for today, it was just to show the media and others, for the community to see how ready we are, but also take into consideration that all our facilities in the Western Cape, anyone can go for the testing if that person meets the criteria. For example, if you have been traveling internationally or you have been in contact with a person who has traveled internationally. But also we will be activating even some, because we are in the readiness of activating some of other facilities in case there's a need for the quarantine, because in Tigerbird the beds might not necessarily be enough. However, we want to encourage the people that it's not necessary that you have to come and test, but the first thing is about the isolation when, for example, you have got the symptoms of you have traveled. And also the testing, and also for us, we've got a responsibility to contact, to trace the contacts, so that we don't have a community transmission. As long as we make it a point that we detect, we identify, we test, we isolate, and then to prevent the whole of the transmission.
Let's talk a little bit about this 36-year-old patient, because this individual, he returned home on the 9th of March, right? Upon his return at home, it's the 11th now, and if you have to do the math in terms of how many individuals he actually came into contact with, right? How many people did he actually come into contact with from the time he landed, right up until the time he was home, to the time he detected the fact that he was not feeling well, to the time that he had to put himself into private health care. So all those individuals that were involved within his circle, and you and I both know that this is a connectivity issue, right? All those individuals that were involved in his circle that came into contact with him, where are they now? Because this individual, from what we understand, is actually back home in self-isolation. And my second question, therefore, will be to you, is that even a good idea?
Tracing contacts in the South African context, that's what we'll be doing in case, for example, for TB cases. So it's part of what the system does. So also take to note that the patient has already been traveling about in 4 countries before he came to South Africa. So even those contacts, specifically where he traveled in the plane, those he sat next to, they has also to be traced, which is the responsibility of the DECO and the National Department of Health. So far as the Western Cape, where the patient was tested, which is the GP, and also other people surrounding that area have already been contacted and have traced them. And also some of the immediate contacts have already been traced. The next phase about tracing the contacts of the contacts. Of course, it will be quite an uphill, but it's part of how we're supposed to do in order to contain the virus so that it doesn't go outside in terms of affecting the community transmission.
Doctor, you're saying that they've already been traced. The question then is, have they been traced and tested? And if they've been traced and tested, when are we expecting those results back?
Traced and isolated, because you might not be able, when you get someone now, we might not be able to test immediately. Traced and isolated, the first part of it. It can take about 24 to 48 hours, but what is important is about you identify, detect, isolate, test, after you have done the tracing, and then you see then whether there's a need for the self-isolation if the person doesn't present with the symptoms, and if there are symptoms that could be able to easily to be transmitted to other people, and then that person can opt to, or if there's a need from clinical perspective, to be quarantined in the hospital.
Why is this specific patient now self-isolating at home? Was that what motivated you to actually make that kind of call? You know, this is a serious virus that we're talking about here. It's not like a common cold.
It will be advisable for everyone who has been detected in terms of the coronavirus to be institutionalized, because some people don't necessarily present with the symptoms. Remember, the virus can be spread through the droplets, and in most cases some people don't present with any kind of the symptoms, but it's only the detection of the virus. And when the circumstances allow, because if, for example, is a person who's a traveler and also is a person who can be able to access the private, because even if he would have chosen to come for the institutionalization, it will be at the private hospital. So we have to take into consideration the circumstances and also how will that impact on the community at large. Because if it's a person who stays all by himself anyway, and at what extent that person could be able to spread throughout, but noting we also have got a responsibility to follow the person in terms of ensuring that it doesn't spread throughout. Self-isolation.
Doctor, I just want to interject there. We're talking about the spread of the virus. My concern is about the well-being of the certain patient. As much as we're trying to contain the virus, that it doesn't spread, but we cannot negate the fact that we're trying to ensure that this individual must be healthy. So when we're saying that we're going to self-quarantine him, what guarantee do we have that he's going to have the necessary medical experience that allows him to get healthy by himself?
Self-quarantine is about the person doesn't have to go to the hospital in order to be admitted, but it doesn't mean that there is no constant follow-up. Because remember, when they're in the hospital, it's not necessary that they might be receiving any treatment. They'll be just moving around in that space, talking, eating, and so forth. So in the case of where the circumstances can allow for the person to have self-isolation, where there's no contact, but it doesn't mean that we don't keep on watching the case. Because we avoid a situation where everyone gets institutionalized unnecessarily. But what is important is about how do you contain it. So we are doing that.
Yeah, and the reason why I'm asking this question, Doctor, is simply because right now, remember the case of the 38-year-old woman who came into contact with the 10 that went to Italy. Now the reports are saying that she's in a critical condition, right? And that was after reports that had said that actually they were sending her home. So the reason why I'm asking you this is because if we're sending these patients home, what guarantee do we have that they're not going to now slump into a critical condition, whereas opposed if they were placed in an institution, that monitoring will be within reach, and also you're able to make timeless decisions around their health care?
Yeah, that's why they're being followed up throughout. Because remember, it's still the process. It takes about 2 weeks to trace the contact. So in between, the patient is also being also monitored. Also, today, like we have got now confirmed 13 cases, and we anticipate there will be more of those. At what extent now the system will be doing all the quarantine for all the cases. That's why we have to evaluate case by case. But the most important thing is about to contain it, so that it doesn't spread throughout the community. So we have to, as I indicated, that it's going to be looking into what are the circumstances that will make the clinician even to suggest, because it's between the clinician and the patient, and also in terms of the follow-up, you have to look at all of those in totality.